Hi everyone, I'm here with.
Oh, I'm Nicole.
So can you tell me a little bit about your role here at BCIT?
Yeah, sure. So I've been here since 2016. I've had the opportunity to do a lot of clinical classroom simulation, preceptorship, and I'm recently now our BSN placement lead.
Okay, perfect. Can you tell me a little bit about term 9? Because that's a very coveted term.
Yes, it is. It's a unique term, right? So you've been used to kind of going to clinical placements with a group of, 6 to 8 of you and a clinical instructor. So term 9 is very different in and of itself because you'll be paired out there with a nurse. Sometimes just one nurse, sometimes multiple throughout your 12-week throughout your 12-week rotation, excuse me.
Yes.
And you'll be actually working shift work. So you might have had some exposure to 12-hour shifts, but what your schedule will look like is, 2 days, 2 nights for the most part, pending your clinical placement. Mm-hmm. Yeah, it's very different. It's really independent practice, and you see a lot of growth as a student.
Mm-hmm. What is your sort of role now? What are you doing for the students and the faculty?
So I have more of a wider lens, I suppose, on all of our programs' clinical placements. So working with term leads and program heads, making sure we have, the right sites for the right terms and, intakes of students and making sure that our student experience is obviously at the forefront.
So you pick where we go, basically.
I pick where you go, yeah.
If you had to pick to teach any term, I know you were in term 9. If you had to pick any term to teach in, what term would you pick?
Okay, so when I first started at BCIT, I did clinical and classroom, and it was for level 4, which was midway through the program. I really enjoyed that. Now that I have a greater understanding of our full program, I think I would like to try the beginning of it and really seeing, these fresh, new, excited, passionate students come through and it kind of, have their first exposure to the nursing world.
And so last question, do you have any tips for nursing students that are struggling through the program or?
What, it is a hard program, but you can definitely do it. I would say find your community, find your supports, ask, if you're unclear of something, just use the resources that are available to you. I hate to say that, it probably sounds like a broken record and you hear it all the time, but really find what works for you and just practice. We have great simulation labs, we have the open lab. Yeah, look at all this equipment. I think, you can read so much about things and get that theory, but until you have that hands-on practice and you're bridging the two, until that kind of clicks for you, that will feel great when it does, I guess I'm saying. Yeah.
Amazing. Thank you so much, Nicole.
You're welcome.
So look up for this face. She tells you where you're going to go.
I'll be very kind.
Thank you.